Visual field effects are quite easily demonstrated in a patient. Once you know the normal visual pathways in a patient that are followed for a normal visual acuity and a normal visual field, it can be basically the central visual field that is affected in the patients, and it can also be the peripheral visual field that is affected in a lot of patients. So what are the causes towards this visual field effects? May it be the central visual field effects, or it can be the peripheral visual field effects, ranging from the central causes of this visual field effects, which are basically the stroke. It can be the occipital region that is involved, and it can be the brain tumors that can cause these visual field effects in a person. And as well as it can be some of the pathologies of the optic nerve itself. It can be the optic neuritis, whether it is the inflammation of the optic nerve or it is a lesion of the optic nerve. It can again result in the visual field effects of a person. Now, when we talk about the causes that are related to the eye in general, it can be the glaucoma, it can be the cataract. Cataract is usually affecting the central visual field in a person. When we talk about glaucoma, it can be the central as well as it can be the peripheral visual field effects. It can be the uveitis, it can be the corneal ulcerations or keratitis, which can result in the visual field defects as well. Now, when we move on towards the lens itself, of course, it can be the cataract, which is one of the major causes of the visual field defects in the patients, as well as it can be any sort of trauma which is relating to the lens dislocation in a person, and again it is going to result in a visual field effect in that particular patient whomsoever we are talking about. So knowing this normal visual pathway through which basically the normal vision in a person is attained or it is maintained is the mainstay over here in this very first section. So over here we're going to just focus on the fact that the eyes are a window towards the brain. So the eyes are going to reflect whether the brain is functioning in a normal way or not. So over here, we're going to focus on the normal anatomy of the eye. What are the normal anatomical structures that are going to correlate with the brain functionality or the functionality of the central nervous system. And that is basically going to highlight the fact that whether the occipital regions of the brain are working in a proper manner or not. So that is basically the center for the vision through which we can assess whether the central nervous system is acting or functioning in a proper way or not in a particular person. The procedures that are usually being carried out in a normal day-to-day OPD outpatient departments, being an ophthalmologist or even a physician who is just working to check out on the visual field effects of a person, usually there are a lot of tests that are performed which are basically known as Humphrey's visual field test. Then we have the perimetry. It is also known as the visual field defect testing in itself. Then we have the tangential visual field defect testing. So all of these tests are performed in that particular person whomsoever we are trying to detect the visual field defects one should know basically how to distinguish the blind spot, which is basically a normal finding in every person. It is physiological and it doesn't carry any pathology. So one should know how to distinguish between the blind spot and a visual field defect in a particular person. So then we're going to move on to the visual pathways. So knowing the visual pathways is again the mainstay over here in this very first section. A normal visual pathway, how is it maintained? What are the quadrants that we usually divide the visual field into? It can be the nasal quadrants ranging from the upper and the lower nasal quadrants, and then we have the temporal quadrants, that is basically the upper and the lower temporal quadrants in a person. So whenever we find any defect in the visual field of a person, one should know how to basically document it when you're writing down the history in a particular person, or when you're writing down the findings of visual field testing, one should know how to basically label these visual field effects in that particular person. So this is what we're going to discuss over here in this very first section. Now, as I was already emphasizing on the fact that the eyes are basically the windows towards the normal functionality of the brain. So again, it's very important just to focus on the fact that the center for the vision, it basically lies in the occipital region of the brain. So one should know that if the visual field is affected, or it can be the visual acuity that is affected in a particular person, or it can be the ocular movement of the eye that are affected in a particular person. So it can be that the central nervous system is not functioning in a normal way, and usually the occipital region or the occipital lobe is involved in this non-functionality of the central nervous system. So if a person has any problems regarding the visual field effects, it can be the brain tumors, it can be the infections that are relating to the brain. For example, it can be the meningitis infections that are relating to the brain, or it can be involving the occipital regions of the brain. It can be any sort of trauma that basically affected the occipital lobe of that particular person. Usually, when there is a head-on injury during the road traffic accidents, the coup and the contra-coup injuries are usually affecting the occipital lobe, or either it is the frontal lobes that are mostly affected in the people after the coup and the contra-coup injuries of the brain that are basically resulting due to the decelerating and the accelerating injuries that are affecting the brain, or that are affecting the central nervous system of that particular person whom we're talking about, or that particular patient whom we're dealing with. So this diagrammatic representation is basically giving you an idea how we go to basically differentiate the visual fields into the four quadrants. Over here, when we have a look at this, there is an upper temporal quadrant over here, and then we have a lower temporal quadrant. So basically we have the temporal regions, and then we have the nasal regions that are again divided or further divided into the upper nasal quadrants, and then we have the lower nasal quadrant. So usually these are the visual fields for the right eye, and this is basically the macular region. So if this visual field is affected, that is mostly the central visual field is affected, then one should know that basically the macular region is involved, or the pathology lies in the macular region of that particular eye that we are concerned with. So if you have a look over here, the temporal visual field is usually resulting due to the nasal part of the retina. So this is very important, because once we'll be discussing the pathologies or the lesions, one should know that if the nasal part of the retina is affecting, or if the patient has a lesion over here in the nasal part of the retina, the visual field that is going to be subsequently affected is the temporal field. So it's vice versa situation, and one should remember this thing just to get a better understanding of this visual field effects. And if the temporal retina is affected, then it is going to manifest as a visual field effect in the nasal region. So it's basically a vice versa situation, and that is something that one should remember just to have a conceptual view of the visual field effects in a person. Then obviously the optic nerve is involved over here. We have the optic chiasma, so the lesions can be involving the optic chiasma as well. The optic nerve can be involved, and then we have the lateral geniculate bodies over here. So any trauma, any infections that can relate towards these lateral geniculate bodies over here, that can again manifest as the visual field effect in that particular person. And then finally, we have the occipital cortex over here. That is again going to manifest as any abnormality or any pathology that is found in this occipital cortex over here. So this whole visual pathway, any lesion that is involving in this visual pathway, may it be a central cause or may it be the geniculate bodies, the optic chiasma, the optic nerve, or the retina, it is going to affect or it is going to manifest as a visual field defect in that particular patient. Visual acuity, as we've already focused on this fact, that visual acuity is usually demonstrated in a person through the Snellen's charts that are usually kept at a 6 meters difference, and then you ask the person to read that chart, and then you're going to demonstrate what kind of a visual acuity defect he or she may be suffering from. The eye is particularly tested, and then of course the second cranial nerve and beyond is the visual pathway. So whenever we are testing the visual acuity in a particular person, all of these cranial nerves, that is the second cranial nerve, as well as the structures of the eye, as well as the visual pathway is being tested whenever this visual acuity is being tested in a particular patient. Then we're going to move on to the visual field effects in this particular patient. Whenever we are talking about the visual field effects, it can be a manual demonstration of the visual field effects in that particular patient, ranging from the perimetry. It can be the tangential visual field effect testing in a person, and then it can be the Humphreys testing. That is again basically one way of testing the visual fields in a particular patient. Usually one eye is tested at a time, and these particular tests are being carried out to detect the visual field effects in a person. It can be the central visual field effects, or as well as it can be the peripheral visual field effects in that particular person whom we're talking about. The central and the peripheral vision is affected or usually tested in that particular person. Usually it is the testing of the retina as well as to the cortex. In between we have the optic chiasma, in between we have the optic nerve, we have the geniculate bodies that are being tested whenever this visual field effect testing is carried out in this patient. Then we have the ocular motility. So we have this third cranial nerve, then we move on to the fourth cranial nerve, and then we have the sixth cranial nerve. So there is an easy way to remember these cranial nerve pathways when you are testing the ocular motility. Usually all of the extraocular muscles are supplied by the third cranial nerve, except for the superior oblique, which is supplied by the fourth cranial nerve, and then we have the lateral rectus, which is supplied by the sixth cranial nerve. So this is a general rule to remember the ocular motility whenever we are testing the extraocular muscles in this particular patient. So the eye examination, it is usually carried out just to check out this optic radiations. Over here we have the optic chiasma, we have the lateral geniculate nucleus over here, we have the left and the right geniculate nucleus for the visual pathways on the left side as well as on the right side, and then we have the visual cortex. So this is basically called the Meyer's loop, that is basically from the optic chiasma towards the visual cortex, and it's again one of the loop of the nerves that is tested whenever we are carrying out the test for the eye examination. The reflexes that are usually carried out are the pupillary light reflexes, that is going to check out the second and the third cranial nerve in this particular person. Then we have the accommodation near reflexes, that is for the near vision. You ask the person to look distantly, and then you ask him to quickly look at something. You basically provide him or her with a reading chart at a near distance, and you check for the accommodation reflex in that particular patient. Then the corneal reflexes are also tested in this particular patient. Through these corneal reflexes, we are testing the fifth cranial nerve, and we're also testing the seventh cranial nerve in this particular patient. So the retina, which is also including the optic disc in this particular patient, it is going to highlight any increased intracranial pressure. That can be a part and parcel towards the diabetes as well. Or obviously, there are a lot of other reasons towards this increased intracranial pressure, ranging from the infectious states and as well as it can be the other traumatizing states in a particular patient as well. So the status of the blood vessels is tested for in this particular patient, reflecting the hypertension, or the other causes can be the trauma, or it can be the other infectious states that are usually visualized in these patients. Then we have the visual pathways that are tested for this particular patient. The lesion along the pathways produce the specific defects. So one should know what is a normal visual pathway in this particular patient, and then we'll be discussing the different lesions at different levels. It can be at the level of the optic nerve, it can be at the level of the optic chiasma, or it can be at the level of the geniculate body, or at the occipital cortex which is involved, or the defect of the occipital cortex that can be manifested in a particular patient depending upon the level of the lesion. That can aid in locating or localizing this lesion in this particular pathway. So this is the normal visual pathway that we've already discussed. These colors are basically showing the nasal as well as the temporal zones of the visual fields. And then in the center, we have this macular region. So this macular region, if there is any defect found in this region, that is basically going to focus on the fact that the macula of that respective eye is affected in a particular way. Then we have the retinotopic examination that is observed in these patients. Pathway extends from front to back towards the brain. There is a precise retinotopic organization of these vessels. So once you have that fundoscopic examination, one should know how to examine the vessels of the eye and what is the normal way these vessels are depicted in the fundoscopy. It's again very important. The deficits due to the lesions of the pathway give the valuable localizing information that is given accordingly towards the visual field effects. So this is basically how we examine the eye whenever we are going to manifest the visual field effects in a particular patient. How are we basically going to differentiate a normal visual pathway from any lesions that can basically happen at any level in a particular patient. So that is the end of this section. Thank you for watching sqadia.com.